Hi, I'm Dana Daniels, and I am doing my interview for my communications speech class, and I'm interviewing with Vicki Sprayberry. Vicki, let me introduce you.
Hello.
Hi. Vicki, I want to thank you for allowing me to interview you, and I wanted to, you're in a profession that I'm interested in pursuing, and so I wanted to ask you a few questions about that. Would you tell our audience who you are?
My name is Vicki Sprayberry, and I'm an occupational therapy assistant.
Okay, and what made you choose to become an occupational therapy assistant?
My brother was in a coma, and he was in rehab, so I was there every day, and I decided to shadow the OTPT in speech, and that's what made me decide to become a CODA.
Okay, so you basically researched your field, really,
I did.
and then made your decision on that. So can you tell me what a typical session would look like?
I get to work about between 6 and 6:30, and I do ADLs with my patients. So I go around and I check up on all my patients, make sure they're there, and talk to the nurse to see how their night was. And then I go into the room and I greet them. And then we decide what they're going to wear, and we do their hair, we do their brushing the teeth, and if they decide that they need to take a bath, clean them up if they need to be cleaned up, and basically get them ready for breakfast.
Okay, and so first of all, how long have you had your degree?
I've had my license for 9 years.
Okay, and where did you earn your degree at?
Becker College in Worcester, Mass.
Okay, and how long does it take?
It takes 2 years.
And what does the program entail? When you say 2 years, what does that mean?
It takes 2 years, and the first year is book work, and then the second year are clinicals. And on your book work, it's like anatomy, speech, adapted equipment, basically modalities and stuff like that.
Okay, and then what do you do on the second year?
We do level 1, you go and shadow a CODA or an OTR. And then the second level, you get to actually treat the patient and write the notes and stuff, and they basically kind of teach you and kind of see what you know on your own.
So do you do all different types of things, or do they send you like only to one type of place, like a hospital?
Two separate ones. I went to a special needs daycare with pediatrics, and then I did a hospital.
Okay. And was it ever, when you were in school, was it ever so hard that you just wanted to quit and give up?
Yes. It was during anatomy. Anatomy was really hard, and the instructor was a nurse, so it was... She didn't much like OTRs.
So what made you push through?
My kids and myself, and then if it wasn't for me shadowing the OTRs and the therapy people, then and then telling me that I did a good job and the progress that my brother made, I don't think I would have been good at it, but they said that I was.
Now, do you think that if it wasn't for your brother and everything that you went through, do you think you would have chosen this profession?
No, I'm a retired hairdresser. I've been a hairdresser for 24 years.
So do you think you would have kept doing that? Or do you think...
Probably.
Yeah? Okay, and so I know that people can specialize in areas. Have you specialized in anything in the occupational therapy assistant?
I have. I did some home health, and I found out that I had to do some adaptions to the bathroom and for adaptions for ADLs. So I took a couple of classes on that so I could get certified to do it.
Now, when you specialize in an area, are you able to gain a higher pay rate when you're marketing yourself to companies?
It depends on where you go.
But
if I was to do home health again, since I have the certification, yes.
Okay. All right, and then what I know that you work in geriatrics, so what made you choose geriatrics over any other type of place that you could have gone to work at?
On my clinicals, I did pediatrics, and I ended up treating the moms more than I did the kids.
Mm-hmm.
And I have a lot of kids myself. And I tried a hand clinic, and I just prefer geriatrics instead.
Okay. And when you're talking with families and discussing things about how their loved one's doing, is that difficult?
It is, because, it's hard to see that your mom or your dad isn't able to brush their teeth or get out of bed or get dressed, and we have all busy lives, and so I try to make my patients as independent as I can. But if they aren't able to, what I try to do is meet up with the family and find out what they got to do to go back home, and we work on that. And then when I see that they're unable to, or they're at their highest potential, I ask for case conference, and I had the family come in and kind of watch me do the therapy with them, and then they can see for themselves what their family can and cannot do, because there are some patients that see their daughter or their son, and they ask them to do it, and I know that they can do it for themselves.
Mm-hmm.
Could be brushing your hair, brushing your teeth, washing your face. So I try to give them their independence back.
Mm-hmm. Okay. And then, do you have any advice for me?
Mine would be that if you was to when you do your clinicals, do something that you would never think that you would try something different. Okay, instead of pediatrics and geriatrics, try some different place that you just be curious on what it'd be like, because it's not a set job. That way you can experience it,
Mm-hmm.
and see how it works out.
Okay, well, I've learned a lot. I've learned how long it's going to take me to get through school, and I've learned what it's going to entail and what I need to do to push through when I find that it's hard. And I want to thank you very much. You've given me a lot of great information, and I really appreciate it. It will help me make a decision on becoming an occupational therapy assistant.
Well, thank you, and good luck.
Thanks.